Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends in healthcare technology. I'm here at the 2023 Ontario MD conference here in my hometown of Toronto, Ontario. It is definitely a rare privilege that I get to cover health IT here in my own home province. I was very excited to come to the conference today because I wanted to find out what's happening in my local province in terms of technologies, in terms of trends. And I had the opportunity to sit down with my friend Aidan Lee, Director of Certification Programs at OntarioMD, and Matt LaDuke, Director of Integration. I wanted to find out what technology trends they are seeing because OntarioMD has such a unique position in the market here. And I was also curious to learn more about their work when it came to interoperability here in the province. I hope you enjoy this interview as much as I did. Aidan, Matt, welcome to the program.
Thank you.
So Aidan, for the benefit of our audience, can you maybe give us a quick overview of your role, your title, and what you do at OntarioMD?
Sure. Happy to be here. My name is Aidan Lee. I'm the director of the EMR certification program at OntarioMD. Under the certification, what we do is define specifications that includes functional workflows, expectations set for vendors and their products, and we do conformance and compliance against these expectations. And it's an ongoing piece, so there's work that the team heavily gets involved with each of our vendors.
Nice. Matt?
I'm Matt LaDuke. I'm the Director of Products, Integrations, and Service Management. And my portfolio really is almost a subset of Aidan's. So we have a series of vendors who've been through that certification program. My team's job is to help those vendors access services and integrate with all the various provincial services that we have there for giving better information on patients as their clinicians see them.
So first of all, again, I'm excited to speak with both of you because you have a very unique perspective on the industry up here in Canada and specifically in Ontario. You work with so many of these vendors, as you just mentioned, Matt. Give us a little bit of your overview, your perspective on the whole EMR industry here. What are some of the trends? What are some of the things happening in that industry right now?
So there's always a lot happening in the industry, and we face a constant sort of set of expectations around, do we have too many players in the industry? Does it dilute the ability for any one player to really advance the landscape? Or do we have not enough players in the industry? Do we have a bit of a challenge that there's not enough emphasis on distinguishing themselves in the sort of the research and development aspect? What we're seeing right now, and what we've seen over the last couple of years, is a lot of sort of movement as the larger market share players really try to seize what they can in terms of opportunity to improve their services. They look at what's happening out there. The smaller players are a little bit more agile, and they're in a position that they can start introducing things in a faster way.
So today, with the certified EMRs that we have today, there's 14 products actually in Ontario. You might think, well, that's not really a consolidation. And in fact, actually, to Matt's point, there are large players, but it really provides choice to the community, right, in terms of what's available. With the 14 products, it represents 11 vendors. And why the disparity? Some of the vendors have more than one certified product with us. All of these EMRs that are certified with us meet a certain set of expectations, right? Some of them being whether it's about security and privacy standards, data standards. These are all set and defined in the certification. To be clear, we don't set these expectations. Merely what the certification program does is uphold the expectations on behalf of, say, Ontario Health in Ontario, who is an agent of the Ministry of Health and also Ministry of Health. These expectations the standards especially are what we do is ensure that these products meet those expectations to participate in the ecosystem.
You just mentioned that 90%, we've got 90% adoption here in Ontario, which is fantastic. And now that we've got more electronic medical records it allows us to potentially share that data. But we all know that interoperability in healthcare is quite a large mountain to climb. OntarioMD and other folks here in Ontario have invested a lot in OLIS, which is the Ontario Lab Information System to allow sharing of lab information, and a few others. Talk to me about that. How far have we made, how much progress have we made in interoperability here in Ontario?
Yeah, let me speak, and this is where Matt and I, it's great we're here together because he can certainly speak more on the product side of things.
Sure.
But just starting with the standards alone, we've come a long way, right? Because one thing about the program, what we are able to shepherd is the use of standards, right? With in the past, it used to be about just adopting an EMR, but now with the focus about maturing the use and trying to connect systems, well, how do you connect the systems, right? We once were using different standards and whatnot. We are moving in Ontario very focused on fire-based standards is what we do. And that's really helping drive other systems to use the same sort of standards. DHDR is one probably we could probably talk a lot about. It's our digital health drug repository that was recently integrated with EMRs that we have, and that is fire-based messaging.
The reality is that we have achieved all of our wildest dreams from 15 to 20 years ago when we sort of first set down the path of interoperability. But of course, that finish line has moved substantially forward. And we've got a long way to go on this one. OLIS has been a tremendous success story in a lot of ways. The ability to access information that is there today in almost every family physician's office in Ontario to get lab results, whether they were requested by that physician or not, it's incredible. A much younger version of me would say, wow, it's incredible what we've done there. And the version of me today who has a whole new set of expectations says there's a lot to still be done. And OLIS is one of our more mature, more successful products. Aidan was mentioning the drug repository and the integration we have today in terms of medication information that your family physician can actually see, again, whether or not that was prescribed by that family physician, what you're taking, what you've actually picked up from the pharmacy and what you're consuming in terms of meds. It's really important. And yet, again, what we can do today just doesn't stand up to the level of maturity that people are expecting out of the landscape. And so there's this constant, the finish line keeps getting farther away in a way, even as we keep bringing more and more to it. The investments have been substantial, and they need to continue to be substantial because we're moving a landscape that relates to 20,000 physicians and then all the other clinicians and practitioners and support staff who work with them. So hundreds of thousands of people who are working on the working side of it and many millions of people who are on the recipient side of it.
So would it be fair to say that how you're approaching interoperability is tackling the things that are, because it sounds like you're tackling it very practically. You're talking about lab results, you're talking about medications, two of the things that most family physicians would want access to when it's prescribed or when it's requested by someone else. You're not talking about the main record being totally interoperable right out of the gate.
We're advancing some work actually right now on what we're calling the patient summary, which is the idea of an extract of that main record being available. And it's a standard problem, right? I mean, you're traveling and you break your leg and you go to the nearest hospital. Well, they don't have the whole record of your family physician, or you're sick on a Saturday evening, or your child's sick on a Saturday evening, and your family physician can't take you, so you take them to the walk-in, doesn't have the whole record. The concept behind the patient summary is that critical baseline information is going to be made available. But to your point, it's not pulling the whole record. It is cherry picking and saying, well, what is the minimum that someone needs to be useful here? And medications, of course, and allergies, of course. And there's a select number of sort of categories of data that we can make available. It's probably not a reasonably practical plan for us to make the whole record there, because when I'm seeing somebody for episodic care, that practitioner doesn't need to know that 4 years ago I had such and such condition or I had surgery for this. In very rare circumstances, is that really relevant?
Yeah, and just to complement that about the interoperability and the standard, I think what's important to get out of that is, there's standards, we uphold the standards, we try to continue to evolve these standards, but one of those key successes that we've had at OntarioMD is helping define its use, right? And how does it apply in real life situation, right? It's great when a standard exists, but at the end of the day, a physician doesn't look at the data standard. They look at their medical chart, right? And that's not expressed in a standard form. It's expressed in the way they best know how it works in their clinical workflow, right? So that's something that I think we've done very well in Ontario, especially for EMRs and for clinicians. It generally has been successful as we try to adopt new services and standards that they're expressed for clinicians in a clinical workflow. Right? That's just something I think we pride ourselves in. It's something really.
So for both of you, what does success look like? Because as you said, the goal line and the finish line for interoperability keeps moving. We're never going to be done. Right? I think that's a false notion that one day we'll be totally interoperable, because I think we'll just redefine what that really means. But for the next year to 2 years, what does success look like? What will make you happy to say, hey, we've now achieved something meaningful in terms of interoperability here?
Success in the next year or two. So I have the luxury of being very practical in how I measure that. We've got a couple of services in the landscape today between OLIS, the Laboratory Information Integration, and what we call Health Report Manager, which digitally delivers all the records that used to be, and in some cases still are, being delivered by fax. So I sort of have 3 measures of success in the next year or two. Those 2 services, very mature, but they need to improve, and there's active work underway right now on sort of key elements that we can bring about in the near term so that physicians can get a better experience, and therefore they're empowered to give better care to their patients. So that's the first piece, is if we can actually see those changes through. The second measure for me is with regard to the stuff that is new or upcoming. So we've got the drugs integration, we've got the patient summary, we've got electronic ordering of lab results. These are all things that either are recently introduced or are in the process of being introduced. 1 to 2 years, you can imagine, for me, the success is, okay, have we started to get traction? Do we have physicians who are actually benefiting from this? So that's my sort of second measure of success. And the third, of course, to your point, that interoperability finish line keeps going out. So in the next 1 to 2 years, do we have a handle on the next thing we need to focus on? If we can have a decent idea on something that physicians actually want and need, and we can be working toward that, that's my third sort of measure.
And I think that last component is a big one in terms of what they need, because if you think back not too long ago, maybe a year or two, what was the focus? It's all been virtual care, virtual visits, virtual tools, right? Coming out of the pandemic, if you will, that focus is probably less on virtual tools. And, I think we always have to ask the question, what's next, right? And for me, going to that last piece is, so what is that next big thing? And it might be, dare I say, AI, because we hear a lot about it, right? So these are things that we are constantly looking into.
So let me ask you that, and we'll cue on that. Is there a technology, because again, you have a unique perspective here, talking with a bunch of different vendors, talking with fellow people in here in Ontario, working towards interoperability and adoption of technology in primary care. What's exciting you? Is there a technology that's standing out for you right now?
Yeah, I mean, that's a very tricky question, right? Because when it comes to technology for me in general, it's exciting for me. I'm a background in technology, right? So everything always gets my attention. I mean, certainly the market is talking a lot about generative AI, right? That is a fundamentally, that's all you hear about today.
Sure.
But the big question for myself, especially not only from an interoperability, for what purpose are we using that for, right? We can say, okay, let's adopt the AI. Let's adopt AI for what, right? And that's still a big question for me. It's not to say that let's ignore it, but we really need to understand. Turning back to what we were just talking about. So for a clinician, what is that problem that we're wanting to solve, right? Like any standard, you can create a standard, but it needs to be used for something, right? So how are we applying that? And that's really important in terms of seeing success. We can create technology, but if the technology doesn't have a purpose behind it, it's not going to be successful.
Matt, is there a technology that you're
Well, I mean, the one thing I think that's interesting to note with that question is that it depends. I mean, you note our unique viewpoint on this one, which is an important one, because if I'm a physician today, what might be most exciting to me is a service that is actually available today, but that doc is only getting for the first time now. And so if the service has been around for 18 months, but I'm a doc who's only seeing it today, well, that's the most exciting thing for me. From my perspective, much like Aidan, it's easy to say AI. That's what everybody is talking about, thinking about. Machine learning is the future to do something. We're not exactly sure what. And for me, it's the most exciting, not purely optimistically exciting. It's exciting because it is going to be earth-shattering. It is going to be shifting the landscape. And we're at the point now that we have the opportunity to either nudge that in a direction that's really positive, or to nudge it in the direction where, okay, so I hit chat GPT to find out, my symptoms mean such and such, and then I go and buy some medication for it. But no one's really looked at the root problem.
I mean, it's hard to argue with you. I mean, AI is on everybody's lips. In healthcare in particular, it's one of the few technologies where everybody's talking about it, right? I mean, not all of us talked about EMRs when they first came out. Not everyone talks about lab systems when they first came out, but everyone's talking about generative AI and ChatGPT, no matter what kind of clinician you are, no matter where you are in the healthcare space. So in that sense, it's a nice unifying force. But to your point, not very clear exactly how we're going to deploy it or where we should be deploying it. So it'll be interesting to see how that pans out over the next few years. Matt, Aidan, you've shared a lot of great information with us today. Where can people go to find more information about OntarioMD?
Yeah, I mean, it's pretty easy. We're on the internet.
I've heard about that. I've heard about
it's something.
Where can they go?
Yeah, Ask ChatGPT. Yeah, where you can always find more about not only about the certification program, but also about our integration and products on OntarioMD.ca. That's something you can get onto. And if you'd like to know more, you can always email us at EMR@OntarioMD.com.
Excellent. Matt, Aidan, thank you for being on the program today. Really appreciate your time.
Thank you,
so
Colin.
much, Colin.
Hey, I want to thank Matt and Aidan for coming on camera with me and talking about their work in the EMR space, and more importantly, their exciting work in the interoperability world here in Ontario. It was really fascinating to hear all the stuff that's going on behind the scenes with OntarioMD. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you'll find more great content like this. I'm Colin Hung with Healthcare IT Today. Thanks for listening, and I'll catch you on the next video.